There are two groups of ankle plantar flexors. The superficial group includes the gastrocnemius, soleus, and plantaris. The deep group includes the tibialis posterior, flexor digitorum longus, and flexor hallucis longus. These muscles all have lines of pull that run posterior to the medial lateral axis of rotation of the ankle. The two chief plantar flexors are the gastrocnemius, which originates from the posterior surface of the femoral condyles and inserts on the calcaneus via the calcaneal tendon, and the soleus, which originates from the soleal line on the posterior tibia and head of the fibula and inserts on the calcaneus via the calcaneal tendon. These muscles are particularly active during the push-off phase of gait and generate the large plantar flexion torque required for propulsion. The gastrocnemius and soleus account for 80% of propulsion forces of plantar flexion due to their large size.
Seated heel raises. For this low-intensity exercise for the ankle plantar flexors, the patient will sit upright in a chair with feet flat on the floor. The patient will actively raise their heels off the ground until only the balls of her feet remain in contact, and then slowly lower back to the ground. This exercise can be progressed by adding ankle weights or putting weight in the patient's lap. Prone ankle pumps. For this exercise, the patient will lie prone on a treatment table with ankle hanging off the end. The patient will perform active plantar flexion through the full range of motion and slowly lower back down. This works the ankle plantar flexors concentrically and then eccentrically as the foot is lowered back down against gravity. To perform in a gravity-eliminated position, the patient can be side-lying and perform the same motion. TheraBand ankle pumps. The patient will sit on a treatment table with lower leg hanging off the end of the table. Loop a TheraBand around the foot and the patient can hold the TheraBand to resist ankle plantar flexion. The plantar flexors work concentrically in the push phase of the exercise and eccentrically as the TheraBand pulls the foot back into dorsiflexion. To progress this exercise, the patient can use a darker band or put more pressure on the TheraBand.
Calf raises. To perform another moderate plantar flexion exercise, the patient can stand with both feet flat on a firm surface and concentrically contract the plantar flexors to raise the patient onto the balls of their feet. The patient will then slowly lower the heel back to the ground. Calf raises on a raised surface. Patient will stand on the edge of a firm surface with the heel hanging over the side of the surface. The patient will slowly lower the heel below the level of the surface and then concentrically contract the plantar flexors to perform a full calf raise. The patient then slowly lowers the heel back into full dorsiflexion and repeats this exercise. To progress this exercise, the patient can perform this exercise on one foot.
Hop jumps. The patient will stand on a firm surface below a step and jump up onto the step. The patient should minimally flex the knee during the load phase and then perform rapid contraction of the plantar flexors to leap on the step. The patient will then hop backwards and return to the ground. Patient should land back on the ground with the ankles in a plantar flex position and lower back to neutral position.